Good morning, everybody. It's Haley Gibson here. Today I'm going to be doing a webinar. It's going to be about a 30 to 40-minute session addressing the power of nutrition and applicable strategies that you can start applying to your life today. So first and foremost, I just want to thank you all for taking the time to listen. I know we all have busy lives, but it's very important to take time to invest into your health. So congratulations on taking a step towards learning and empowering yourself. So the fact that you're here tells me that most likely you're struggling with some type of health issue, either you or someone you know, whether it's fatigue or cancer or heart disease, depression, diabetes, sick all the time, autoimmunity, whatever it may be. It also tells me that you want to learn how to take care of yourself to the best of your ability. It also tells me that you take pride in yourself. So this is not a talk for people who are not willing to make changes in order to live their life to its fullest potential. This does take a commitment. So today I want to offer you a friend and a coach to help you through your health journey. That would be me. I want to help you take control of your health and help you through the process. And I promise you that no matter what brings you here, nutrition and lifestyle changes can make a huge difference in your life. I know that it personally saved mine. So how do people want to enjoy their life? So mainstream healthcare is directed at disease management. So I just want to talk about that for a moment. Medicine is really great at prolonging our lives, but what is the difference in the quality of our lives when we live healthily versus unhealthily and on medications to cover up symptoms? So I want you to think about a symptom. What if it's fatigue related to low thyroid? So we go to the doctor and they see that our thyroid hormones are low, and then they give us synthetic hormone to cover up our symptom. This gives us energy and beats the hypothyroidism. But what caused that hypothyroidism to begin with? And is it a nutritional deficiency? Is it liver congestion or some kind of gut microbiome imbalance? Whatever it may be will eventually cause a symptom somewhere else. So can you see how it's important to address the underlying issue versus just giving the synthetic replacement? Because this doesn't fix the problem. It may make you feel better temporarily, but it does not fix the problem. So I just really want you to ask yourself this question and take it seriously for a moment. Are you okay with missing out on life, playing with your grandbabies, feeling good about yourself, not just being, but actually feeling good and confident about yourself? Are you okay with missing out on visiting new places or taking that adventure that you've been wanting to take and missing out on these things because your health is suffering? So it could be something as simple as chronic pain that prevents you from living the life that you deserve to live. So today I'm offering a free 20-minute consultation. Really, this is a webinar, so any day you listen to it is fine. If you want to email me at nutrition@drjockers.com, again, that's nutrition@drjockers.com, I would be happy to set up a free 20-minute consultation. And what this will allow us to do is both of us can see if we're a good fit for each other. You can share a little bit of your story, and we can just see if what I have to offer matches your needs. So if you're interested in that, just send over an email. It's a free consultation. All right, so let me tell you a little bit about my own health journey before we get started. So I'm actually a registered nurse and a functional nutritionist. I've been following Dr. Jockers since the year 2010. I knew he was onto the truth, and I wanted to personally learn from him. I just had no idea how to go about this. So once I finished nursing school, I actually worked on a cardiac thoracic floor, and I loved my patient population. I saw a lot of cool things, and I got to help a very awesome group of people, people struggling with esophageal cancer, lung cancer, heart attacks, strokes, GI problems, a little bit of everything really. And I loved this population, like I said, but my issue with the hospital was that I began to feel really task-oriented and like a drug pusher. Unfortunately, the employees in a hospital have probably too many patients, and it was very difficult to develop a relationship with patients. So, for instance, someone would come in with a heart attack and they would have their procedure done or whatever it may be. They had a stroke, and we're sending them home. And I would want to spend all day coaching them and teaching them, okay, you need to do all of this to prevent this from happening again. And patients are very interested in that, but we didn't have time to teach them that. So they were going home on their medication and maybe 10 minutes of education. And then really that was it. So a lot of times I felt like patients were at risk for having the same thing happen to them again. So my passion would be to essentially go home with a patient and coach them through their lifestyle and their diet changes and help them prevent health struggles from happening again. Yeah, so I disagreed with sending them home on just another pill and waiting for them to return back to the hospital. So I knew that Dr. Jockers was all about finding the root cause and helping people make lifelong changes. So I sought out a career opportunity with him, and here we are. But my passion is actually much more than just wanting to get to the root cause of health problems. I'm also very passionate about working with people and their behavior patterns. So the majority of us can say that we're great at giving advice, but are we good at taking that advice? I know from personal experience that I've not always made the best choices in regards to my own health. So this isn't really an easy story for me to tell. Please bear with me. I'll try to make it short and sweet. So my story starts in high school when I developed an eating disorder. I had bulimia, and it was a pretty severe case that went on for about 5 years. So I was really trapped in my head. I had plenty of days where I didn't see the value in my life anymore. I developed depression. I began hiding from society. I became malnourished and caused many detrimental effects to take place in my body. I knew that I wasn't myself, and my physical health was preventing me from being exactly who I am. I prayed every single day for God to take away my food addiction and to give me the willpower to overcome it. I can't tell you how many times I tried and failed. It wasn't until I was honest with myself and with others, spent a lot of time reflecting and praying, really confronting the issue, and then applying my knowledge of healthy living to my own life, not just knowing what to do, but truly applying it. So this was when I was able to overcome the mental block of binging and purging. So the truth literally set me free. Involving someone else in my health issues really set me free. So once I overcame the aspect of binging and purging, I realized that this was just the first step. I still had an emotional attachment to food to be corrected. I had mental judgment and self-love I had to confront. There were a ton of physical side effects and chemical changes in my body that I had to figure out as well. So part of what makes me who I am is my passion for correlating symptoms with lab testing and underlying disease processes. I made new neural pathways in my brain. Let's see. Sorry. So I formed a plan and took control of how I felt about myself, my relationship with food, and health strategies that I used every single day to recover my health. I actually began telling myself positive affirmations and finding my strength and refuge in God. So my newfound relationship with myself and with God are what gave me the strength to break my chains. Breaking free of my chains to worldly obsessions was an amazing feeling that I hope to share with all of you. It does require making a plan, and it does require sticking to that plan. So now I realize that all of you, not all of you, or maybe even none of you, are struggling with an eating disorder. But I know that when you feel trapped by health issues and feel as though you have no control over your health, the feelings are pretty parallel. It's a terrifying experience. You feel really just trapped and helpless sometimes. So, the steps that you need to get right mentally, physically, and emotionally are actually pretty similar more times than not. So, physically, these are the things that I struggled with. I had severe insulin resistance. I was in my early 20s. My fasting blood glucose was ranging between 110 and 115. I was in nursing school and checking myself. I was not responding to the glucose intake I was eating. My body was, deteriorating. So we typically want our blood sugar to be 90 or lower first thing in the morning, and mine was about 110 to 115, which is classified as pre-diabetic. Over 105 is pre-diabetic, and over 126, you get into the range of being diagnosed at diabetic. It does take additional testing, but this is really a big indicator that testing needs to be done. So my adrenal fatigue was severe. I had a really hard time just getting out of bed in the morning, and I did do testing on myself as well. I went through the functional diagnostic nutrition program, and you do testing on yourself. You're your first patient. I was not putting out any cortisol, and my adrenal fatigue had affected my sex hormone production. So for those of you who are familiar with adrenal fatigue, we know that when you have an excess amount of stress, you're going to take away from your body's ability to produce its sex hormones. So I was, 21, 22 years old, and my ability to produce sex hormones was already depleted. I also struggled with fatigue and brain fog, sugar cravings. I was really living just on food. I was living to eat, not eating to live. So at age 19, I was actually told by a psychiatrist that I should take antidepressants to help me. This was really the first time that I felt like the medical community wasn't really listening to my problems and just trying to give me a pill nonchalantly. I really didn't need an antidepressant, nor did I take one. I'm glad that I didn't now. I don't think I even realized how big of an issue that would have become at that moment in time. So constipation and brain fog, crippling headaches, these were the hardest physical symptoms for me to overcome. I would go an entire week without going to the bathroom, and like the pain associated with not going to the bathroom for a week is just unbelievable. For those of you out there struggling with it, it's terrible. Just imagine you feel really bloated and your skin even feels like it's stretching just to hold it all in, and the headaches that go along with that, it was just miserable. But I can honestly say that nutrition and lifestyle changes saved my life. I can stand here and tell you that I have recovered from adrenal fatigue, from insulin resistance, chronic fatigue, depression, constipation, liver congestion, and other things. I feel like myself again for the first time in years. And it's a wonderful feeling, and I want you all to experience it as well. So today I'm going to talk about some of the health strategies that I used on my own journey, but I really want to cover more of the most common issues that I see in just about every disease process that I have helped coach people through. So let's dive into the material that you came here for. So we're just going to touch briefly on some topics. So stomach acid is where I'd like to start, because this is one of the first places that our digestive tract will typically malfunction and start to show symptoms. And when we have low stomach acids, we put ourselves at risk for many health conditions such as infections, malabsorption, mood disorders, hormonal imbalances, nutritional deficiencies, and many other things. So thanks to updated research, we now know that signs of acid reflux are more oftentimes than not related to low stomach acid versus high. However, medications that decrease stomach acid and neutralize it are still being used for symptom relief. Medications such as Protonics, Nexium, Tums, Pepto-Bismol, and many more. How many of you guys know somebody who they go eat Mexican and then they're like, oh, I have acid reflux, I'm going to pop a Tums and I'll feel better? I mean, this is a very common practice in our society, and I don't think we understand what we're doing to our bodies. So let's talk about what low stomach acid means. So typically low stomach acid is associated with the kind of lifestyle that Americans like to live. I'm sure other countries live this way, but I know from firsthand that Americans like to put a ton of stress on themselves and then eat a high sugar and grain diet, and then this affects their blood sugar. I mean, it affects their blood sugar too, but I meant stomach acid. So what happens is whenever you have low stomach acid, it actually prevents the closure of the esophageal sphincter. You can see in this picture, see the little tube coming up from the stomach, that's your esophagus, and it joins at the stomach, and this little connection here is called an esophageal sphincter. So you want your stomach acid to be around a pH of about 2, pretty acidic environment, and this is important for fighting off infection, fighting off pathogens that are associated with our foods that just our fruits and vegetables are covered in. It also helps break down chemicals and help us detoxify the body, and then it also helps us break down nutrients. So all of these things are very important. So if our stomach acid, the pH is thrown off, say it's too high, we don't have a good amount of stomach acid, this is going to prevent the triggering of the closure of that sphincter. So if the sphincter is still open, this allows stomach acid to flow back up into the esophagus. So this is going to feel acidic, and it's going to feel painful to our esophagus. And people are going to think, oh my gosh, I have too much stomach acid. But in reality, they don't have enough to close that sphincter. So also, when we have low stomach acid, that's going to lead to poor digestion. And this means that the food is going to stay in our stomach longer and be poorly digested, so there's more risk for it to come back up through the esophagus as well. I hope that makes sense. So that being said, let's talk about some of the common symptoms of low stomach acid. So heartburn or GERD, gastroesophageal reflux disease, I just talked about that. Typically it's associated with low stomach acid. Bloating and cramping can also come along due to the insufficient digesting of foods. Constipation or diarrhea, this can come because we start to mess with our gut microbiome. We're at risk for infection and bacterial overgrowth, as well as yeast overgrowth whenever we have poor stomach acid. So this can mean that the way we digest foods or even microbiome can begin to ferment these foods before they've even been properly digested. This can lead to shifts in fluid balance and result in either constipation or diarrhea. You're also at risk for tearing down your stomach lining. So our stomach lining and our intestinal lining, they are one cell wall thick, very thin layer. It's a very fragile layer, so we want to take good care of it, but low stomach acid really puts us at risk for tearing down that lining. This can put us at risk for food sensitivities, autoimmunity, infections, things like that. Other symptoms include acne, dry skin, asthma, anemia because we're not absorbing iron, we're not absorbing our vitamins correctly, hair loss, belching, burping, gas within an hour after eating, chronic intestinal infections, undigested foods in the stool, chronic fatigue, things like that, osteoporosis even, because we're not going to be absorbing those nutrients that are necessary for us to utilize what we're eating correctly. So people may be saying, oh my gosh, I'm eating healthy and nothing's changing. Well, if you don't have good stomach acid, this could be the reason that your healthy diet is not truly helping you. It will help change your stomach acid, but it takes time. It does take time. All right. So in addition to eliminating sugar and introducing an anti-inflammatory diet, which I'll talk more about later, one way that I've seen many clients have success with healing their stomach acid and coming off of medication is by using 1 tablespoon of apple cider vinegar diluted in 4 to 8 ounces of water before every meal. So make sure that you get the brand that is raw with Mother, as this has the enzymes in it that aids in breaking down our food. So if this doesn't do it, we actually have a supplement called Acid Prozyme, which contains HCl and other enzymes that aid in stomach acid production. Low stomach acid also impairs the secretion of intrinsic factor. An intrinsic factor is absolutely necessary for the absorption of B12. So let's look at how important one nutritional deficiency can be. Let's walk through a B12 deficiency. Okay, so B12 is extremely critical for neurological, cardiovascular, digestive, and immunological function. So together, B12 and folate reduce the metabolic end product, homocysteine. Homocysteine is one of the best indicators for heart disease and inflammation. So if B12 and folate deficiency could potentially be causing an excess of homocysteine, and we'll talk about homocysteine in a minute, but this could be causing heart problems. This can eventually lead to heart attack and stroke. So if this is the cause, shouldn't we be trying to correct this? Shouldn't we give more attention to this? I'm not saying that B12 deficiency is the cause of heart attacks, but it is a contributor to this process. So let's divert for just a moment and talk about this homocysteine. So it's a very important compound that I want you to be aware of. It wasn't until even the 1990s that homocysteine became associated with vascular disease, heart attacks, and stroke. Homocysteine, whenever it's elevated, can cause excessive clotting. So what happens when we have clotting? Homocysteine molecules can actually make little rips in our arterial walls. You can see here illustrated in the picture. But whenever it makes a tear in our vessels, we have inflammation. We'll have macrophages, and part of our immune system, the white blood cells, will come and they'll try to heal this little tear. And then by doing that, it begins to form what we call plaque. And once we start to form plaque, this narrows the diameter of our vessel. And if this plaque gets too big, it can form a clot. Now, if the clot stays where it is, it will cut off blood flow to whatever's directly beyond it. But if this plaque travels, it can lodge in places like our heart arteries or our brain arteries, or really anywhere in the body. It can also lodge in the legs. Those are a common place. We call that a deep venous thrombosis. And what happens is when these clots form, they cut off blood flow to the area. So let's say that you have an artery in the heart and you get a clot. Well, it's going to cut off blood flow to that part of the heart, and it becomes what we call ischemic. It doesn't have oxygen or nutrients anymore, and this is when heart attacks happen. Same thing can happen in your brain and cause a stroke. So homocysteine is really important that we pay attention to and we're aware of. So where does homocysteine even come from? It comes from the metabolism of protein, specifically methionine. Methionine is found in meats, seafood, dairy products, eggs, sesame seeds, and Brazil nuts. So these foods have a lot of health benefits. So why are we getting something harmful from these foods? Well, let's think about it. So methionine is a protein, that you're consuming, and then it's converted to homocysteine. Now, homocysteine is actually converted into antioxidants and enzymes that we need in our body to function. But if you look at this person over here, you can see the other things that we need to actually convert homocysteine into these beneficial antioxidants and enzymes. So B12, B2, zinc, folate, all of these are extremely important for having homocysteine function effectively. So if you are lacking in B12, we've been talking about B12, and then say you're lacking in folate, B2, or zinc, you could be left with too much homocysteine in your blood, so your vessels are at risk for being torn down, and it's related to those B vitamin deficiencies and zinc. So you can see where this is really important. As I mentioned earlier, even though we may be consuming a healthy diet, we may have something going on that is robbing us of these nutrients, such as a diet high in sugar or carbohydrates. This really depletes the body of important minerals and nutrients. Low stomach acid, we're not going to absorb it and break it down appropriately. Poor gut microbiome balance, if we don't have the right gut flora to break down these foods, then we're not going to have the appropriate amounts of these nutrients. So the gut flora is really important for extracting B12. So if we have an imbalance and we're stealing from our body's B12, it could be related to just a gut flora imbalance, and that needs to be addressed. So you see how we just came full circle back to low stomach acid being the cause of our inability to absorb nutrients. All right, so back to B12. So research has suggested that 40% of people between the ages of 26 and 83 have either very low normal plasma or even low levels of plasma B12 levels. And many of these individuals were actually already suffering from neurological problems, whether it was low energy, low libido, fatigue, depression, mood disorders, whatever it may be. And then people over 60 years of age, it was shown that this percentage actually gets closer to 50% of people over the age of 60 are low in vitamin B12. So it is definitely possible that at least some of the symptoms that we consider normal for aging, such as dementia, this could actually be related to a B12 deficiency. So there are many factors that come into play for the breakdown and utilization of B12, so that leaves so many places for this process to be impaired. So even though you may be consuming enough of the vitamin in your food, you may not have the appropriate means for getting the benefits. So what happens if we're not getting enough B12? Let's look at something called methylation. So methylation is involved in almost every bodily reaction. It occurs billions of times every single day in all of our cells. So that's why figuring out where the challenges are in the cycle and how to help it perform better will significantly improve our health. So you can see here that methylation is important for turning on and off genes. This is huge for preventing cancer. Whenever we have a gene mutation, which is where our DNA and our RNA, there's a miscommunication when we're reproducing cells, and this can lead to abnormal growth, such as cancer. So methylation is a really important part of that process, so we want it to be functioning optimally. So the methylation term is actually a chemistry term used to describe adding a methyl group to a compound. It's surprisingly simple, however, it needs all of its cofactors present for it to happen. And as we mentioned earlier with homocysteine, these cofactors were things like vitamin B6 and B12 and zinc. So methylation, as you can see here, is also really important for building neurotransmitters. Neurotransmitters include dopamine, serotonin, epinephrine, acetylcholine, all of these things. So these play a role in our mood, our appetite, how we sleep, our drive, our motivation, how we feel just throughout the day, our fatigue, our ability to concentrate. So it plays a role in so many different aspects of our lives. It's also involved in detoxifying the body. It does metabolize things like estrogen. Let's see. So down here at the bottom, it also produces a protective coating on our nerves. So our nerves are covered by something called a myelin sheath, also known as myelination when it's produced. So you need good methylation to produce this protective coating around your nervous system. And if we lose this protective coating, our nervous system can become damaged. And you can see all kinds of side effects from this. It's also important for producing energy and building our immune system up. So T cells and natural killer cells, very important. So medications such as birth control pills, NSAIDs, and antacids, like the medications we were talking about earlier, like Tums, these actually deplete these nutrients, and they also consume massive quantities of methyl groups whenever they are detoxified. So this not only depletes us of what we need to have proper methylation, it also uses a ton of methylation enzymes and products that leave us with even less methylation factors than we had before. So it's a very vicious cycle. We really need to stop it. So can you see the importance of just this one nutrient, B12? It's a really big deal, and can you imagine that every single nutrient has just as large of a role in the body in a different way? Everything has its place. So as you can see, it's just really important to find these deficiencies and have a good diet and maintain a good lifestyle. We were definitely meant to have all these nutrients in our bodies. All right, my favorite part. How do we test for these things? So we do actually have a specific test for methylation. You can find these tests at drjockers.com. So the total thyroid panel is what I have right here, but this actually looks at homocysteine levels, which we've talked quite a bit about. It also looks at other important indicators. So I like this as a starter test because we can evaluate many things in just one test. It's very cost effective. This test can look at stomach acid levels as well. We use a complete blood count and complete metabolic panels, which are both typically covered by insurance. And these are pretty standard labs that most people get done annually at their annual checkup. Insurance will cover these labs once a year through your primary care doctor. And you can actually send us these labs. I'd be happy to review them with you. So we can tell how your stomach acid levels are functioning by looking at chloride, which is one of the main components of hydrochloric acid. So when this is low, we just begin to pay attention and look at other signs. So we look at how you're absorbing protein, how you're breaking down protein, red blood cell formation and size and concentration. We also look at iron status and B12 indicators, which include homocysteine. So if you're not absorbing food properly or you don't have good gut flora, you can actually not absorb iron well sometimes. And this is something we find a lot of people end up being anemic because of these issues. So we can actually identify a B12 malabsorption by looking at homocysteine. And homocysteine can actually impair thyroid function, which is what this test is specifically looking at, hence the name, the total thyroid report. So other valuable markers that can contribute to hypothyroidism include iron deficiency, magnesium deficiency, vitamin D deficiency, which is so incredibly common, and C-reactive protein, which is an inflammation marker. So hypothyroidism is a very common problem that we see in a lot of clients. So people may be experiencing low energy, unexplained weight gain, cold extremities, hair loss, brittle hair, constipation, and some of the other things seen on this list here. So can you see why nutrition is so important? It literally impacts every cell and tissue in your body. If we can figure out the areas that are not working properly, we can support these areas and help you get your health back. So for instance, like I told you earlier, most medical doctors are only testing thyroid stimulating hormone and the active forms of thyroid hormone. So if these are out of whack, they just put you on a medication to get your thyroid numbers back into normal range. Like I said earlier, this doesn't necessarily tell us why your thyroid is not functioning properly. So we actually look into antibodies, which are part of your immune system that can begin attacking your own tissue. Antibodies can be responsible for a number of health problems, and hypothyroidism or hyperthyroidism is one of the most common. We also look for stress-induced hypothyroidism. Whenever you're in a stress state, an excess of cortisol can actually prevent you from turning in your active thyroid hormones into turning in your thyroid stimulating hormone eventually into the active forms of thyroid hormone, but instead can turn it into a pseudo form that does not act the same. We also look at functional hypothyroidism related to liver function, nutritional deficiencies, and gut microbiome balance. All right, so from there, we actually formulate a plan to address the underlying reason that we see here. So, all right, moving on to the organic acid test. This is another great starter test that we have. It's called the organic acid test. Unfortunately, most doctors will not be able to run this through insurance as of right now. However, it is my favorite test right now. It's a simple urine test. If you order it from us, you do it at home, you send it off to the lab, and then we get the results back and we go over them with you. But you can actually look at several complex biomarkers from metabolic pathways. So it kind of gives an overview of several major systems in the body and an analysis of nutritional deficiencies. So this test can actually show us many of the B vitamins. It looks into amino acids and neurotransmitters such as dopamine, serotonin, and epinephrine and norepinephrine. It assesses how you are utilizing energy. We look at mitochondria function. We can also identify things such as yeast overgrowth, bacterial overgrowth, and fungal exposure, all of which are very common. You would be surprised. We can also look at antioxidant status, as well as oxalates. Oxalates are a big contributor to health issues, and we can actually test for the metabolism of that on this test. So I really love this test because we can look at so many different things. Alrighty. Getting to the end now. So I love this slide. Apparently you have to eat healthy more than once to get in shape. This is cruel and unfair. So I said it once, I'll say it again. You have to truly commit. This is not like, oh, I'm going to eat healthy for 2 weeks and then I can go, back to my old ways of living. No, that's not how this works. This is really a commitment and a lifestyle change. So we want to focus on putting more good in than bad in. It's all about balance. We want to equip our body to handle the bad stuff because we are never going to live in a bubble and be completely shielded from all of the chemical exposure, all of the toxins and pesticides. We're never going to be completely shielded from the extra stresses that life puts on us. The emotional stress of everyday life is enough to cause aging. So how well you take care of yourself speaks to how serious you are about your destiny. Unfortunately, we're so full of for now solutions where you take shortcuts, and we should know by now that anytime you take a shortcut in life, it is going to cheat the quality. It's going to reduce the quality of the end product that you get. So don't cheat yourself. Really invest in your health and take it seriously. You have one body, you have one life. Let's live life to our fullest potential. So you may be thinking that this won't work for you, but I just have to remind you of where I was just a couple of years ago. sure you may think that I'm young and that's why I got healthy again. But another example I can use is a client of mine in her 70s. She's always been relatively healthy, but began struggling with fibromyalgia, acid reflux, fatigue, and constipation, as well as brain fog. So I did an elimination diet with her, dropped her sugar intake, added a couple of supplements and natural healing strategies, and she actually came off of medications for acid reflux and pain. She feels so much better. Her bowel movements are more regular, and she's now more active in her church again. So, her and I would both tell you that this takes a commitment. It's a lifestyle and not a short term treatment. You don't eat healthy for a week and then expect it to be over and go back. So, it's completely worth it. I will never forget the day that I experienced a clear mind for the first time in years. It was a really big deal to me. I could finally think clearly. First and foremost, I owe my recovery to the Lord and the resources that He provided me with. I know that I recovered and continue to recover because of my diet, lifestyle changes, and my mental changes. So, this is kind of the food pyramid that my diet looked like. So, in addition to removing all processed foods and just focusing on healing whole foods, this is what our food pyramid looked like. I'm not going to go into a bunch of detail about this today. We don't have time, but just notice that the bottom of our pyramid consists of a lot of healthy fats. Things like avocado, grass-fed butter, coconut oil, pasture-raised eggs, extra virgin olive oil. These things are very important. Every cell in your body has a fatty membrane around it, so we really need to take care of these membranes and rebuild them with good, healthy fats. Above that, lots of vegetables. We all know vegetables are great. We want to get non-starchy vegetables. Use a lot of herbs. Herbs have very powerful healing properties. Add them to all the things that you cook and make. Drink herbal teas. Berries, very low on the glycemic index scale, so we do incorporate berries full of antioxidants. And lemon and lime, they also help regulate blood sugar, so these are really great. Next up there, you see clean protein. So we're getting great sources of wild-caught salmon, grass-fed beef, wild game such as deer meat, and pasture-raised chicken. These are all great sources of protein. Then we have nuts and seeds. A lot of people go overboard with nuts, so I do want to tell you they are a little hard on our digestive system, so moderation is key here. Add them on top of a salad, a quick little handful for a snack, something like that. So pecans, almonds, walnuts, Brazil nuts, pumpkin seeds, all of these are really great. Chia seeds, flax seeds. And then next on top of that, we have fermented foods. So fermented foods, as I was mentioning earlier, our gut flora, very important. So fermented foods provide you with the healthy gut flora, probiotics that are going to help break down your food and extract your nutritional value from these foods. That includes things like kimchi and fermented vegetables, sauerkraut, coconut milk yogurt, coconut water kefir is a great one. You can find this at your grocery store as well. Just make sure you're checking for sugar content. So the last thing up there on that list, natural sweeteners. So raw honey and grade B maple syrup, coconut sugar, and organic sugar. These do have an effect on your blood sugar, so definitely use them in moderation. These are more of a treat. Stevia and monk fruit and xylitol, these things don't have as big of an impact on your blood sugar, so they're great to use just in moderation. Xylitol is a sugar alcohol, so you could have a little digestive upset when you use this. Personally, it doesn't bother me, but I know that it does bother some people, so just something to be aware of. But stevia is a great sweetener. It doesn't have an effect on the blood sugar. That's something that I use personally in a lot of recipes, so that's a really great one. You can check out other videos for a lot more information on the diet that we focus on, but that was a very brief overview. So I just want to thank you for coming. And don't forget about the free consultation that I offer. You can email me at nutrition@drjockers.com. If you're committed and ready to make changes, I think we would make an awesome team. I truly can't wait to get started. Thank you for joining me today, guys. Have a wonderful day.